A hazard is the potential for harm, physical or mental. In practical terms, a hazard often is associated with a condition or activity that, if left uncontrolled, can result in an injury or illness. Identifying hazards and eliminating or controlling them as early as possible will help prevent injuries and illnesses. The main categories of hazards are physical hazard, chemical hazard, biological hazard, ergonomic hazard, psychological hazard. Physical hazards. A physical hazard is an agent, factor or circumstance that can cause harm with contact. They can be classified as type of occupational hazard or environmental hazard. Physical hazards include ergonomic hazards, radiation, heat and cold stress, vibration hazards, and noise hazards. A chemical hazard is a type of occupational hazard caused by exposure to chemicals in the workplace. Exposure to chemicals in the workplace can cause acute or long-term detrimental health effects. There are many types of hazardous chemicals, including neurotoxins, immune agents, dermatologic agents, carcinogens, reproductive toxins, systemic toxins, asthmagens, pneumoconionic agents, and sensitizers. Biological hazards refer to organisms or organic matters produced by these organisms that are harmful to human health. These include parasites, viruses, bacteria, fungi and protein. Some examples of biological hazards are mold and fungi. Blood and body fluids, sewage, airborne pathogens such as the common cold, stinging insects, harmful plants, animal and bird droppings. Ergonomic hazards are physical conditions that may pose risk of injury to the musculoskeletal system, such as the muscles or ligaments of the lower back, tendons or nerves of the hands/wrists, or bones surrounding the knees, resulting in a musculoskeletal disorder. Ergonomic hazards include awkward postures, static postures, large forces, repetitive motion, or short intervals between activity. A psychological hazard is any hazard that affects the mental well-being or mental health of the worker by overwhelming individual coping mechanisms and impacting the worker's ability to work in a healthy and safe manner. Sources of psychological hazards are workplace violence and harassment, working alone, technological change, fatigue and hours of work, substance abuse, depression, anxiety, other mental illness, age-related factors, work-life conflict.